This is Rob Tebbutt for Boxing Social in association with Betfred. Delighted to be joined for the first time, I add, by Dr. Rod Ballellos. Hopefully I've said your name right. The Matchroom Boxing Doctor. How are you, Dr. Rod?
Yeah, not too bad, not too bad. Good to hear from you, and nice to meet you and having this interview. It's going to be interesting.
It certainly is going to be interesting. For people who don't know, you are the new Matchroom Boxing Doctor. As you mentioned, an interesting interview when it popped up on my in my emails from Anthony Lever. Shout out Anthony Lever, Matchroom Boxing USA. I thought that's interesting. I think that's a very positive step. Let's find out some more. So here we are. So why don't you tell me a little bit about you joining Matchroom and your position there?
Of course, I'm a practicing emergency medicine physician in Las Vegas, of course, one of the fighting capitals of the world. And actually, my boss that I work for is actually Dr. Flip Pumansky, who's, a boxing legend here in Las Vegas. And I guess Eric and Sean from Matchroom approached Flip to see, hey, is there anybody else there that might be interested in doing something with the boxing community, medical-wise, and they thought of me, so I got connected with them, and here we are.
You mentioned that about being approached to sort of get involved and to work alongside Matchroom. What's the remits of your job? What type of things are you going to be basing your time doing and spending your time doing?
Well, I guess this has been in the works just for a little bit, just trying to get ideas. Of course, pre-COVID, Matchroom wanted a physician to help overlook and oversee some of their fighters. Of course, there's the ringside doctors, the boxing commission doctors and things like that, but they just wanted somebody else to kind of oversee it and make sure that, pre-fight, post-fight, any concerns that the boxers may have regarding health or injury or whatnot, or any symptoms that may pop up after a fight, where everybody's either trying to go home, the commission's not there anymore, nobody else to look out for them. A lot of these guys, they don't even have, guys or gals, they don't have, primary care physicians or someone to contact after a fight or, pre or post, and if they need any advice, that's what I'm there for.
Sounds very interesting. One thing I would like to discuss is, there are, being a contact sport, being a combat sport as boxing is, there are of course numerous health issues to navigate through and that pop up here and there throughout the sport. One of the first ones to discuss would be making weight. In the process of making weight, dehydration is obviously a big topic in boxing. Yes. What's your view on that, and how will your role be catered around looking after fighters who are obviously dehydrating themselves to make weight?
I guess, living in a town of Las Vegas, we're in a big desert area, I guess here in Vegas, we got a little versed with it. Even these last few months, it's been hitting hundreds. We get a lot of people here coming in with dehydration. But of course, it's part of the sport of boxing, to cut and make weight, but of course, the biggest thing is to do it the most healthy way in order to be able to rehydrate and be at your best. And so, of course, like I said, it's part of the sport, and I'm here to help oversee it and make sure that they're, after the rehydration or even during the dehydration process, they're not going into danger modes where they could injure themselves either pre-fight, during the fight, or after the fight, because of course, yes, it is their career that they're looking out for, not just one fight. So I hopefully the fighters themselves do it the safest way. They have their trainers. I'm pretty sure that they're experts at it. But, just to get overview, just to make sure some of the signs and physical symptoms that potentially could happen with dehydration and rehydration do not show up.
It's interesting that you would say that. And obviously, when it comes to dehydration, there are certain things that people will look out for. When you say things about danger zone with regards to dehydration, what are the types of things that you're looking out for and that you're looking to monitor?
Well, I guess, I'm going to always go back to my ER roots, just because of course I'm an ER doctor. There's a lot of different kinds of dehydration and also to the electrolyte things that could happen with it. Sometimes, of course, if you're dehydrated and you're not getting enough nutrients, especially sodium and things like that, of course, that could create muscle cramps. Sodium and potassium go hand in hand. And so sometimes certain things, if your sodium is bad, you could affect your potassium, your lactic acid could build up. And of course, things you look out for are muscle cramps. Sometimes too, when we get people in the ER that are really dehydrated, sometimes their sodiums are very low, what we call hyponatremia. Of course, there's certain technical things about hyponatremia, whether you're dehydrated or not dehydrated, but sometimes overhydrating or hydrating too fast can cause a few things such as brain swelling. It's called CPM, or cerebral pontimyelinosis, I believe. And you got to monitor for those type of things so they don't get dizzy, they don't get brain swelling, which of course, doing it right after, making weight, rehydrating yourself too quickly, and then going to a fight where you're not tip top neurologically, that could of course spell danger.
What do you make of, I mean, this is more an opinion piece, Rob. I'm certainly not going to try and hang you out to dry on this, the answer that you give here, but what's your overall opinion and your overall thought process on the weight making process, and the fact that fighters are willing to kind of dehydrate themselves, in some instances very dangerously, then refuel and go into a combat sports event?
Of course, from a medical standpoint, and being very conservative, the way I practice and how I view patients and see and disposition them, of course, there's a lot of things that can make me go, whoa, like, wow. I mean, you're really pushing your body to the limit and things like that. Of course, me not being a boxer trainer specifically, where they do this on a fight by fight basis and a long career. Of course, I'm not the most versed to say how they do it, but of course, it's going to be a learning experience on both sides to get more of the nuances and make sure that some of these nuances that they're doing and try to perform to get their fighter ready. Learning, it's going to be a big learning curve, but also, make sure that there are certain things that to look out for that. So like, maybe you might want to rethink that.
Now, one of the things, the final question on the weight making process and dehydration, one of the things that we're often hearing from fighters is that they've outgrown the weight, or they've done too many weight cuts and their body physically cannot make the weight anymore. What sort of thing causes that in a fighter? And what are the potential long-term effects of a fighter boiling themselves down and expanding, and boiling themselves down and expanding again?
Of course, that's a very difficult question, but I kind of, it's almost kind of, to explain it a little bit, maybe it's almost kind of like your body tolerance. Your body is always under training and things like that, and your body does grow. I don't know if it's a good analogy to use, like Olympic gymnasts and things like that, cutting weight and things like that. By cutting it down weight, and you kind of grow a tolerance to being able to do that. And instead of being here and then you're here and then you go down and then you go up, sometimes it's that base that you go back down to. It just, the base goes higher and higher, and your body just tends to adapt a little bit. And so I guess the only way to really describe it is maybe a little bit of body tolerance, and your body's just, it's growing. Body's always constantly changing, and it'll adapt.
Okay, well, I found that very interesting. Hopefully people who are watching did as well. Moving on, before we talk about coronavirus and COVID, and I'm sure the many issues and obstacles that's thrown up, not just for yourself, but obviously the boxing industry as well. One of the biggest problems, and certainly one of the biggest talking points in boxing, is the use of performance-enhancing drugs in boxing. Now, one of the reasons that I'm excited to speak to you is to have have somebody who is now working in boxing in a medical capacity, who can kind of discuss these things and discuss performance-enhancing drugs. What's your experience? What's your knowledge of performance-enhancing drugs as it relates to combat sports?
Of course, recently getting into this and looking up some of the banned substances and things like that. One of the big things, I'm like, wow. I mean, there are a lot of things, like even some little things that you wouldn't even think of that could potentially be banned. Like, of course, one of the medication that we use all the time in the emergency department is Toradol. And it's a great non-narcotic pain medication, which really works great for kidney stones and bone pain and things like that. But certain of those things, it's a huge list. And of course, I see it could be problems in a lot of sports, especially the combat sports, and with the unfair advantage, and of course, combat sports, risk of hurting somebody else. It's not fair fighting, and you just got to make sure that follow the rules, and make sure none of even the things you would think of that could be okay to use. A lot of these things go into metabolites, and you don't want to create false positives and things like that, because it does affect a fighter's career and the reputation as well.
With regards to performance-enhancing drugs moving forward, I mean, contamination is one of the big issues, and certainly it's not uncommon for us to see a fighter fail a test and then claim contamination. Is part of your remit and part of the job that you're going to be doing with MATCHROOM to be essentially a soundboard, or be approached by fighters, or potentially somebody in their team with questions regarding performance-enhancing drugs or what they're putting in their body?
I'm pretty sure that's going to be part of MATCHROOM, but we haven't really worked out the logistics of certain things of that. Of course, with helping in their health, just general health and maintenance, people get colds every once in a while. Sometimes they, if they have asthma, certain medications like steroids really help with the lungs. And my part there would be, especially if they're not in the fight time and they're just on the off time where sometimes they could still get a surprise test. I would be able to help with reasoning and things like that. Steroids, glucocorticoids really help with the lungs. If they're asthmatic, there's a medical reason for using it and, help clarify certain things.
Final question on performance enhancing drugs. Again, another grey area and another big talking point throughout not just boxing or combat sports, but sports in general is the use of therapeutic usage exemptions, TUEs, in boxing. Yes. How common are TUEs in your experience for elite level athletes?
To tell you the truth, I'm not very versed of that as far as doing research on the TUEs. So I wouldn't be able to give you a good answer on that. Yeah.
No problem. That's fine. Moving on, the elephant in the room, or should I say the elephant around the world, coronavirus, COVID-19. Seems like an awful long time ago that we were, quote unquote, normal. Obviously, this has been a move that you've been discussing with MATCHROOM before coronavirus, but just how big of an impact has this been on, I want to talk about boxing and sport, but obviously the world in general, being a physician as you are.
Yes. Well, of course, it's a big impact. I'm a big sports fan, not just boxing, football, basketball, soccer. I feel like the world needs sports. Sometimes the world just needs a distraction from all the craziness. But of course, being on the emergency department side, where I'm actually seeing the cases that come in from old to young, it is a problem. And unfortunately, there's still not an answer to how to control this and stop this. The best we could do is practice all the safety guidelines that are put forward to us. And but like I said, long live sports. We need some sort of distraction instead of hearing all the negativity and seeing everything. Of course, it's a tough world, but sometimes people need a distraction.
Being an emergency physician or working in the emergency room, and feel free to answer this as detailed or as not as you're comfortable with, it's not a problem. What was your first experience of encountering coronavirus or encountering somebody with COVID-19?
I guess my first experience was actually during the time where it was starting to take off and we're starting to get all the news from it. I was actually on a 2-week vacation, of course, at home, but I'm starting to hear all this stuff on the news. And I was probably just like everybody else, like, oh, sounds like a bad flu, especially with all the information that we were getting to. And then my first shift back, I was like, okay, I made sure I had my mask. First shift back, a couple of my doctors that were on already, they had full, what we call PAPRs. I mean, the helmet, the air blower with the purifiers. I'm like, wow, this thing it's that serious. And then, of course, one of my first patients that I had, of course, it's an elderly person, of course, looking at the records, history of asthma or COPD, but they were just in so extremis that, I was like, wow, we've seen this person all the time. We're able to turn them around. And then, of course, right off the bat, have to put a breathing tube or intubation. And that was kind of a reality check of how seeing these cases, how bad they could get. Even more recently, I have a lot of friends around Las Vegas who are nurses and things like that, nurses, staff, respiratory therapists. I'm seeing them come into our ER. Just sitting there, but just huffing and puffing. And so it's crazy how we're seeing peaks and valleys. Initially, we thought we had it under control. Not that many cases were coming in. But of course, now we're seeing another resurgence, and a lot of our ERs are getting impacted with people that we have no room for in the ICU anymore. So we're actually holding them in the ER. So it's just crazy dealing with all the peaks and valleys.
What was Las Vegas like? I travel to Las Vegas often with work. Obviously, you being a resident of there, I think the strip was close to 78 days or something like that. I can imagine that being a very surreal period of time.
Yes, very, very, very much so. Driving down the strip, like when they said they could close it down, a couple nights later, I went and drove down it, and it's just eerie seeing how, even on a random January winter 0-degree day, there's still people running around the streets. Even on 110 degrees weather during the summer, there's people everywhere. It's just surreal seeing the strip that empty and with most of the lights dim. Here in Las Vegas, of course, like I said, it's peaks and valleys. They are starting to open up some casinos. My fiance and I, we barely go to the strip, but we love eating at some of the restaurants. And a couple weeks ago, it's like, okay, let's eat at one of our favorite restaurants inside the Bellagio. But of course, seeing how many people were there, granted, yes, they're handing out masks. There's actually hand washing stations, a lot of hand sanitizers and things like that. We actually just made a U-turn because seeing that many people in a closed-in space, it just gives me chills. You just don't want to take that chance.
Yeah, I mean, we're going off topic a little bit here, but I mean, as I said, I do travel to Las Vegas often and go to the casinos for work and pleasure a little bit, not gonna lie.
Yeah.
And when I saw that the strip had opened up after a couple of days, and I was stunned at the amount of people there. I mean, there were some with masks, some without, but everybody, there was no social distance. It was actually quite scary.
Yes, exactly. I mean, some hotels are probably better than others as far as, partitions between some of the gambling areas, like the craps tables, roulette, and some of them I've seen, they're just nothing, just like nothing ever happened.
That's incredible.
So scary.
So, Matchroom Boxing returned to America in Tulsa, 15th of August. Now, when the fight was announced, I had a look at the COVID rates for Oklahoma and Tulsa and saw that they were pretty high. I think the day after the fight was announced in Tulsa, officially announced, they'd had their record number of cases. I believe it was around 1,000 cases. Just talk to us about the process of getting the fight done, what you've had to do from a medical background to ensure that, obviously, safety being paramount on any boxing show, but this one, obviously, a step higher.
Yes. So, of course, when we heard of the news, the immediate thing was, how are we going to make sure everyone travels safe, keep the camps and the fighters safe, all the staff at the zone and Matchroom. So a lot of planning went in behind it as far as strategies. And we figured out the best strategies were that once the fight was announced, everybody, of course, try to be strict quarantine as best as possible, safely, social distancing, mask, good hand sanitation. And of course, we figured that we, of course, don't want to infect each other, but we don't want to even worsen the pandemic than it is by, of course, going into an endemic area. We're traveling from all over the place. So, of course, we figured that we would be doing pre-fight and flight testing in order to ensure that people are safe to go and travel. And then, of course, once we're there, quarantine and before any of the real events, such as press conferences, weigh-ins, and of course the fight, we have another test to be performed in order to ensure that nobody contracted anything via flight, or God forbid, if one of the tests was a false negative prior to fighting, we could catch some of those ones too. Also too, during fight week, I'll be helping. We have a few helpers there as well too, medically wise, that would few helpers otherwise there, medical wise, that even if after testing, we'll be checking on them, taking temperatures, making sure that they don't develop symptoms, in order to just, like I said, keep everyone safe, make sure we don't infect anybody else, if God forbid, if we're an asymptomatic carrier, and of course, do not contribute anything at all to the worsening of the pandemic.
That's very, very in-depth and very detailed, which is obviously what we're looking for in these kind of very, very uncertain times.
Yes.
You touched upon something there which has caused a lot of consternation among some of the top-ranked shows that returned in Las Vegas, and that is of false negatives, false positives. We've seen fighters test negative in one moment and then positive the next, but then as soon as they come out of the bubble, they're negative again. What causes that?
Of course, I always like to say that in medicine, there's no 100% or 0%. There's no real test that will be 100%. Certain CAT scans, heart catheterizations, and there's always still a margin of error. With regards to the testing, of course, each test has an endemic, I want to say fault, but every test, yeah, I guess every test would have some sort of fault. Like I said, not everything's 100%. During, say, oral, so there's oral swabs that are there, but if you ate or drank or smoked a cigarette right before, of course, it could alter some of the DNA and have a false negative. Sometimes false positives can happen because who knows, you might have a different respiratory virus because this is SARS-CoV-2. There could be other ones that it could potentially cross-react with the reagent and unfortunately give you a false positive for COVID. Unfortunately, our nasal passages, they are breeding grounds for a lot of bacteria and viruses. I don't know if you heard of staph infection. Sometimes we swab noses and you just happen to be colonized with staph in the nose. And so other things in cross-reactivity, of course, there's always user error. The person doing the test may not go back into the area that you need to get. Sometimes, I guess an example is strep throat. You know for sure they have strep throat, but if you just didn't swab the right area, you can still have a negative result. So there's a lot of different nuances that could create either a false positive or false negative. And of course, that's why we're just going to keep constantly checking up on everybody, making sure they don't develop any symptoms, and of course, doing a double test just to try to catch as much as possible. Like I said, nothing is 100%, unfortunately, but we're going to do our best to make sure the safety of everybody involved.
I think that's fair to say. I mean, a lot of people over here have been kind of, even for all the best will in the world, predicting anything with regards to the COVID or coronavirus is impossible at the best of times. But obviously nothing, as you say, is 100% in medicine.
Yes, exactly. And all we could do is do our best and, test and social distance. I mean, even with a mask, it's not 100%. Social distancing, it's not 100%. But if you do all these things, masks and social distancing and safe practices, by adding all those little percents, hopefully that, say, the 97% chance you won't get it will be 98, 99, and as close to 100 as possible.
Okay, well, Dr. Rod, I found this extremely informative and very, very interesting. I'm now going to ask you a question. I'm pretty sure the answer is going to be here, and feel under no obligation to try and make it anything other than the obvious answer. Okay. How long do you feel that we're going to be needing to operate under these guidelines?
That's a pretty tough question. Unfortunately, by hearing everything and the way testing is, the way the vaccinations are going, and even just learning about viruses itself, unfortunately, I think COVID will be with us for a long time. Knowing that we had our first peak pre-spring, and then we're having another peak during the summer. Unfortunately, flu season is coming up, and we got to be able to test everybody and test constantly, ramp up the tests. And unfortunately, it's just going to be here for a while. The vaccination does show promise. Hopefully, the more widespread availability of the test, as well as the quickness you could get a result. I'm seeing some companies are trying to do a paper antigen test where you could do it at home, and like a nasal swab or some of the HIV tests where you could get over the counter, get an answer in 30 minutes and have these tests readily available. All these things hopefully will lessen the amount and the spread, and of course the degree of the pandemic. But unfortunately, it still seems like a long way ahead.
Okay, well that was the answer that I thought you would give. You elocuted it much better than I ever would have been able to. Dr. Rod, thank you so much. This has been excellent. I'd really love to make this a regular feature of what we do. I think boxing in general has been calling out for, let's say, more recognized physicians, more people who I can actually go to with a medical issue in boxing as a journalist, as a reporter. I think this is a great step for MATCHROOM, so credit to them and to you. Look forward to catching up with you sometime soon. Thanks very much for speaking to Boxing Social.
No, thank you very much. I appreciate it.
Thanks, Rod.
You're welcome.